Following the policy statement by the Nigerian Governors Forum to increase funding for primary health care, a public health expert says it's imperative to have such conversations as the functionality of primary health centers across the Federation is questionable. Dr. Tuyi Mebanwadu was on our flagship morning show, The Breakfast.
And then the primary healthcare, speaks to the majority of the population of Nigeria. Okay, majority of the population. The policy framework, the thrust of that primary healthcare is determined by the National Council of Health. Okay, the National Council of Health involves a lot of people: federal government, commissioner of health, permanent secretaries in different state ministries of health, donors. They come together and do a framework. Who is now to implement this framework? Okay, who is going to supervise it? The supervisory role is based in National Primary Healthcare Development Agency, domiciled in Abuja. They receive the Consolidated Revenue Fund 1%, they receive it, and then disburse it down to the State Primary Healthcare Development Agency, and then define actually the kind of packages that are supposed to be rendered. Now, even when you are going to do National Strategic Health Development Plan monitoring and evaluation, or you are going to do joint annual review or midterm reviews, it still has to come from the federal government trying to look at those indicators that you need to use to drive those things. So, like I said, I don't know what Adewale is talking about. The work, how to ensure that the primary healthcare system will reside primarily, of course, essentially with the federal government, especially in terms of funding. Now, the state will not take the thing further down by monitoring, evaluation, and aggregating those data and send those data right straight, to the federal government, which will be the input in assessing where we are as far as health system is concerned. There's no place. You know what that will mean if Adewale says that the primary healthcare is not the responsibility of federal government. You know what that will mean? Different states, different local government will have different indicators, different method of implementing anything. I don't know where that is done in the world. Okay, that means that the indicator of priority to those states may be different from the of Lagos State, may be different from those of Zamfara State or Port Harcourt. That means that we have a disjointed health system and we cannot be able to monitor. So I don't know what that prof was talking about essentially.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.